Hi, welcome. My name is Stephanie Osborn. This is case study 2. We're going to talk about the utility of operant extinction. We're going to do this by talking about my friend ZG. He is a young boy of 10 years of age with autism. He utilizes a PEX board to communicate with others at the clinic. He lives at home with his mother and dad and siblings. He needs about 10 to 12 seconds to process an SD before he complies, either correctly or incorrectly. Any and all medicines are taken at home. He's on a kosher diet and will eat the items that are out of his lunchbox. He wears a pull-up and has a bathroom protocol to sit for 2 minutes. And he is independent with pulling up his pull-up and his pants. He is currently working on a backwards change for washing his hands, which means he's working on drying his hands. We also have a supporting goal in there to pump the soap. That seems to be one of his more difficult tasks when we're teaching him this. Therapists track all spontaneous and prompted demands with his PEX board with a schedule of reinforcement of an FR of 3 and 2 to 1 minutes of reinforcement. He physically stunts with his whole body, usually while sitting on a beanbag, a mat, or trampoline. Sometimes he will do this while standing up, so it's the same movements but his head is more like going towards the ground. So he's sitting, when he's doing the sitting, he is sitting on his knees, rocking back and forth while slamming his hands on either side of his body with forceful thrust. This is one of his preferred things to do during his sensory break, which we'll talk about here in a minute. He likes to run his hands through people's hair who have long hair. He reaches out to touch his peers and others, but sometimes does this too forcefully. That's where we get some of his physical aggression. We're working on showing him how to tap people on the arm to get their attention or to have that physical touch. Looking out the window and jumping on the trampoline are his second most chosen activities to do during a sensory break. Today I will talk about his mouthing behavior and the interventions that are in place for that. Some other things about Zach, we hold his hand whenever transitioning because he's a high risk of elopement. Prompt utilization of his PEX board in order to make sure that he gets his preferred activities or items that he mans for those. Provide non-contingent breaks, which we're going to talk about in a little bit, every 15 minutes of high fives, clapping, that sort of thing. We do have a schedule of daily schedule for ZG, providing sensory breaks accordingly. But today we're going to talk about his mouthing. So any instance in which Zach puts his mouth on an edible object, an inedible object, or inserts the object into his mouth. Zach puts the beanbag and the wash rag in his mouth. Those would be examples, or putting his mouth on the window. Non-examples would be if he puts his toothbrush in his mouth while running the toothbrush target, or putting his mouth on a cup to drink water. Replacement behavior is to use an oral sensory tool. There are some proactive strategies that we use before he engages in the activity or the mouthing. It incorporate preferred assessments. Set out 2 or 3 reinforcing items to see which one he gazes at or reaches for. Make sure we know what he is reinforced by other than that mouthing. Place clear and simple demands like sit down as opposed to sit down when you're ready. And then control access to reinforcements. The reactive strategies, and these I'm going to break down a little bit more as we go on, but when ZG is engaging in his mouthing, we block from continuing to put his object in his mouth. We display a neutral face and we do not comment on the behavior. Even to say, here's your chewy, do not say anything. Prompt the use of the oral sensory toy. And then we track the frequency for which he is mouthing. The other two things that we do for him is every 15 minutes of the hour. So an hour goes, 45 minutes of an hour go by. The last 15 minutes is this automatic sensory break that he has several choices that he can do. And then every 15 minutes within that hour, we are offering high fives, we're doing some clapping, fist pounding, that sort of thing, in order to get that touching in there. So operant extinction. Anytime a previously reinforced response is terminated from reinforcement. This operant extinction was selected because the frequency from which ZG was mouthing undesirable objects was 75% greater than the time he was engaging in therapy or play. Within a given 15-minute period of time, he would engage in the mouthing activity, moving from the beanbag to the window to the mat and having those objects in his mouth. It didn't matter the SD, he would continuously mouth an object in front of him. It became difficult to distract him from his mouthing on anything else like his cup or providing him with a chewy. Mouthing on the window, beanbag, and mat that other kids use in the clinic are becoming dangerous for him. We have the outbreak of COVID-19 already around the clinic this year, so this intervention was put in place. So the reactive strategies, I'll just review those again. What we did in order to provide this extinction was to block him from continuing to put the object in his mouth, display neutral facial expressions, and not commenting on any of the behavior, even to say, here, chew on this. We didn't say anything. We would just point or hand him, physically hand him his oral sensory toy that he was allowed to use. Socially mediated. Other interventions that are included in his behavior intervention plan, socially mediated access, where access to the reinforcer is given through another person. The function of this behavior was determined to be sensory and or access to a sensory opportunity. In order to give ZG various sensory options throughout each given hour, the therapist is to give high fives or fist pounds every 15 minutes, regardless of what is happening or going on. Conditioned, unconditioned, conditioned, and generalized. So I'm going to provide examples of different reinforcers. So unconditioned reinforcers without having prior learning, something that is reinforcing to a person. So for example, ZG needs to be touched or touch people. So engaging ZG in the touching and telling him to have gentle hands would be an example of that. Conditioned reinforcer, something becoming a reinforcer through a learned history. ZG would be putting things in his mouth to chew on and having access to his chewy when he is exhibiting mouthing would be an example of a conditioned reinforcer. And then generalized reinforcers, when a consequence is paired with access to many different reinforcer consequences until it took on a reinforcing property of its own. So these sensory breaks, he is given the option during a sensory break to go outside, to play with Play-Doh, to sit on his mat, to have access to his beanbag. So he has lots of various options, and those are every 15 minutes on the hour. So after 45 minutes, the last 15 minutes, you'll see that in his schedule here in a minute. Stimulus control. Stimulus control exclusively or high rates of responding in the presence of a stimuli rather than in its absence. So ZG receiving a high five or a fist pound every 15 minutes. He doesn't engage in the behavior at any other time, and this is a way to help him learn how to touch others in an appropriate way by giving him a high five or a fist pound or that touching on the arm. This is an example of his morning schedule. So you will notice a couple of things. Every 15 minutes, it's not on here, but every 15 minutes, it is broken up pretty good so that every 15 minutes he can get that high five, the fist pound, the touch on the arm, those sorts of things. And then every 45 minutes to the next hour, he is getting a sensory break of his choosing. And with that, the conclusions are from Cooper. He suggested that Pavlov's calls the extinction process a sense of reserving of conditions and taking place more slowly. So you'll notice this is a very extensive process that we are putting ZG through in order to help him access his sensory in a more appropriate, age-appropriate way, and something that he could continue to do throughout his life. Um, I just, just I just described this slow and steady, orderly, concise process to give access to what he needs while curbing the desire to mouth on objects that would put him in harm or danger. Um, Torelli's 2017, he analyzes the multi schedule reinforcers were effective in decreasing behaviors. We are seeing that as well. We've got his daily scheduling going on. We have every 45 minutes he's getting a sensory break, and every 15 minutes he's getting high fives, touches from adults in his care that are caring for him. And then Vulgaricity in 2015 establishes that preference assessments might have assisted with their intervention of the working with kids with food issues. And I would say that is definitely the case with ZG. The therapists are to conduct, that's one of our proactive strategies, a preference assessment throughout the therapy session in both morning and afternoon, just to make sure that we have what he is his highest preference throughout the session so that we know what to kind of help him with. Thank you for listening. I hope this helps you understand a little bit more about what we were doing for my friend ZG. Thank you.